Wishing you all a very happy afternoon. I am Dr. Harinikrishna, and I'll be presenting on corneal foreign bodies, a study from a secondary eye care center in rural South India. Our center is situated in a semi-rural area in rural South India. So our purpose of the study was to study the demographic details and the clinical features of individuals presenting with corneal foreign bodies to our center. So it was a cross-sectional study done over a 6-month period, and all patients who presented for the first time with the corneal foreign body were included in the study. Patients with penetrating injuries or conjunctival foreign bodies or open glow injuries were excluded from the study. All patients were subjected to a questionnaire which they answered, and the clinical features were noted by the ophthalmologist and recorded. So coming to the results, we had 119 subjects in the study with a 90% predominance of males. And it was seen that 52% of the subjects belonged to the working age group of 21 to 40 years, which meant that the corneal foreign body was leading to loss of manpower and money. So we wanted to look at what occupations these subjects were involved in. So most commonly they were involved in metal industry, which was around 44%, followed by construction industry, which was 15%, and agriculture around 11%. And the most common activity they were involved in while the fall of foreign body was found to be welding in 36% and metal grinding in 12%. And both of this were common in both the construction site business and also in metalwork industry. So the most common material of foreign body, which was found to be metal, which was close to 54%, which is followed by vegetative matter, which is 9%. So patients who presented with a metal foreign body, 77% of them had presented with a rust ring. So when there was a rust ring, the patients had to come for multiple visits as well. And 12% of the patients presented with corneal infiltrates surrounding the foreign body, but almost all of those infiltrates were less than 1 mm, and they did not need any referral. And 20% of the subjects presented with old corneal opacities, which meant that they already had a similar history and they had come back with repeated injuries. So coming to the wearing of protective glasses, so only 19% of the subjects were wearing protective glasses during work. And when we asked them about the common reasons, they said that it was very uncomfortable for them to wear the glasses, and also there was non-availability of glasses at workplace. And 25 subjects tried to remove it by themselves. So what they used was, most commonly they used currency notes, and some of them used cloth and even fingernail to remove the foreign body. And also 44 subjects used over-the-counter medication, and almost all of them being steroid drops. And 14 subjects had used native treatment like breast milk, coconut oil, and one person had used hen's blood as well. So, and 2 subjects got their foreign body removed by a traditional healer who removed it with her tongue. But it was not removed, so she came back to us for the removal. And we also looked at any association between presence of corneal infiltrate and traditional methods or native treatment, but it was statistically insignificant. And we looked at the education level of the subjects, and it was also seen that 80% of the subjects were not even aware of the corneal body can cause any morbidity, and it was associated with a low level of education, and it was statistically significant. So to conclude, corneal foreign body contributes to eye-related health issues among individuals in working age group, which I already mentioned. It's causing loss of manpower and money and time. So this occurrence is mostly due to lack of awareness and also a low level of education. So what we can do is only promote awareness programs and ensure that there is availability of protective wear in the places where these people work. So what we wanted to do after the study is we wanted to start a dedicated counseling to patients coming to our center. Our center is a small one, so it was possible to give dedicated counseling to every patient who presented with corneal foreign body. So we tell them the risk and the importance of wearing protective glasses. Also, we started giving pamphlets regarding use of protective wear. And also, since we have regular workplace camps, so we also started asking the doctor to tell them wherever we go, not only to the workers, but also to the owners of the factories to provide protective eyewears and also encourage the workers to wear protective eyeglasses. These are my references. Thank you.
Thank you. Especially, I'm liking the counseling part. Of course, that's a new thing. But how many you have got insect wing? Have you got insect wing foreign body?
Yes, madam. But most of them are, the insect wing is usually in the conjunctival form, upper tarsal conjunctival. We had taken only corneal foreign body, sir.
And how the eyes reacted to breast milk?
Ma'am, breast milk is presented with severe congestion, ma'am. Severe congestion, but it's even for conjunctivitis, patients come with breast milk. It's a common.
Did you find any secondary infections like fungal infection with the use of the steroid? And
Sir, to
those
us it
people
didn't present, sir. It's a
are there any
secondary center.
no fungal infections?
Sir, there was infiltrate in patients, sir, but it was almost all of them were 1 mm or less. So we don't have a microbiology because it's a secondary center, sir. So we treated by ourselves, but we did not need any referral for these
The
patients.
use of the tongue and the breast milk and all, and no
So there were only
fungal,
2
very
patients
lucky.
who presented like that, and they did not have an infiltrate.
So, how many patients were having superficial corneal foreign body, and how many had
Ma'am,
impacted
when
deep?
it was around 33% had superficial, and the rest had deep foreign body, ma'am, which we had to
So-
remove with a needle.
With a needle?
Yes, madam.
No, but with a, if they were deep foreign bodies, how would you remove them with a needle?
Ma'am, if it were too deep, we would refer the patient, ma'am. If
Okay,
it were,
you don't have any person to
we don't
repair
have a
corn-
cornea clinic, ma'am. So we have, it's a secondary center. So whichever is possible to remove by a general ophthalmologist, we would do it. If it were beyond our, we will.
So here is something, I asked a question because I wanted to say two things. One, that sir was saying, it is very easy to set up a microbiology lab yourself, even in a secondary center or in a primary center also.
Yes.
You need minimal things from GRAM and KOH. This is the first thing. Second, every ophthalmologist should learn how to repair a cornea or a wound.
Yes.
I think that is two things everybody should know.
Yes.